I chose the article Employee Reactions to Leader Initiated Crisis Preparation for mention. It details a study conducted within multiple organizations testing employees' reactions to crisis prevention scenarios. As I work in the field of education with young children, where crisis prevention does not just affect me, but the children in my care as well, the study is relevant to my career. The effectiveness of crisis prevention itself is difficult to quantifiably measure, as its results are based mostly on what is not seen. That is to say, if nothing bad happens, then it is easy to fall into the trap of assuming that current methods must be effective as a result. By monitoring the employee's sense of risk perception and personal well-being, the study in the article was looking to measure the internal aspects of crisis prevention. The study was formed around two hypotheses. The first consisted of the idea that information given to employees about crisis prevention would be associated with lower perceived risk among the employees, while the second suggested that the information would also result in a higher degree of employee well-being. In order to test these hypotheses, the research team provided questionnaires to 5 different organizations. Two of the organizations were based in the private sector, while the other 3 were based in the publicly based. 20 employees participated from each of these 5 organizations, equaling a total of 100 participants, and questionnaires provided data for the study. There were 2 forms of questionnaires that were provided for the study. One focused primarily on employees whose jobs were health and safety related, while the others were intended for general employees. Each were comprised of a number of statements such as, "I get the social support I need from my colleagues," and "I feel safe at work." Some statements focused on workplace preparedness, while others focused on employees' mental and physical health. Responses were gauged on a Likert scale of 4 levels, consisting of strongly disagree, partially agree, and strongly agree. Considering the subject matter of the study is fairly sensitive as it exposes how safe employees feel in the workplace, the questionnaire used came off as straightforward and not made with the intention to lead its participants towards a specifically desired outcome. This was important in order to get the clearest representation of an opinionated topic so it could be quantified at the end of the study. By the end of the study, the researchers found that crisis preparedness could be linked very closely with a lower perceived risk in the workplace, as well as an increased general well-being among employees from all organizations. The researchers also found that much of this was hampered by more complex crisis prevention plans. Still, the methods used in order to obtain these results were completely respectable and solid for the goals of the study. Using questionnaires as a means to gather the data needed for the study was an appropriate choice in this scenario, as the Likert scale style of response and data collection is most easily obtained through items like questionnaires and surveys. The simplicity of the methodology is also why a large number of participants in the study would have had the potential to help the study greatly. The scope of the population that research like this has the potential to affect, especially from a psychological perspective, cannot be accurately represented by only 100 representatives. I do not have anything to contribute as a suggestion for the demographics included. However, all of the demographics of the employees outside of gender and whether or not the organization was part of a private or public sector were left out of the final report. This is not an uncommon practice, as it helps to protect the identities of those involved, as well as provide a focus for what the study is intending to find. It is a practice that also makes the results easier to apply to multiple fields of study. The discussion sector of the study's results mentioned that the results produced can contribute to crisis management, trust, in organizations in the field of psychology in relation to how governing mechanisms can affect the well-being of those employed under them. Aspects of the study that make it more applicable to different fields also make it easier to raise questions about the visibility of the study in the content of different workplaces. The results of this study support an interactive approach in organizational socialization. As an educator with a focus towards one-on-one assisted learning, crisis prevention in the workplace does not just affect me and my coworkers, as mentioned earlier, but the children whose well-beings we are all responsible for on a daily basis. In recent years, with the apparent rise of school violence and shooting incidents in this country, having a clear understanding of what needs to be done in the event of a crisis on school grounds has never been more important. Research like the kind that was performed in this report could be examined and applied to everyday practices in schools and other educational facilities. If, if this kind of relevant research was applied to the already frequent meetings that principals and superintendents have with teaching staff, even in a small way, the results could be extraordinarily useful in the long run as the means to keep our children's futures safe and secure. Risk management and crisis prevention are two very important aspects of organizational communication. No system can be expected to run perfectly or avoid danger forever. Being able to take the time to sit down with other members of an organization and form substantial discussions and courses of actions for what to do in the event of an unexpected danger can only help to avoid harm in the end.